Welcome everyone. We today have with us Dr. Ujjwal Rathore. He is doing his postdoctoral research in UCSF, University of California, San Francisco. He has done his bachelor's from Delhi University in biomedical sciences and master's and PhD from IISc Bangalore in biological sciences and molecular biophysics. He is part of the team in UCSF which prioritizes their research on viruses, and their major focus for now is corona. He is joining us today to answer our doubts and around COVID and its management. Welcome, Dr. Rathore.
Thanks for having me, Raghu.
Thank you. Thank you for coming, Dr. Ujjwal. And I would like to ask you that in this exceedingly dynamic environment, how essential are discussions like these that we are having today?
I think it's very important to have these discussions in this, currently quick, fast changing COVID situation, because imagine a situation like, for example, you are using an operating system, Windows or Mac on your computer, and every day there are updates coming, and because there are vulnerabilities, viruses which can infect your computer, and you think, oh, what's the point of updating my operating system, because updates are coming every day. However, it's more important to update your system when you are, the updates are, coming more frequently. It means there are more attacks coming. Similarly, for this particular pandemic, because the information is, changing, and we are getting new information every day. I would say that our facts are getting better and better. We are getting more information. So it's important for all the stakeholders that include government, patients, doctors, everyone, all of us to have, these discussions more regularly and update ourselves.
We have been getting a constant question from the people, our member in Discord, that this crisis is ever changing. Tackling COVID, as you said, is dynamic. What are the some of the fundamentals that are the basics which are uh, by now hardened, that these are the things which we know about the virus? If you can put some light to it.
Yeah. So first, a very basic thing which we have learned is it's the COVID infection is caused by a virus called SARS-CoV-2, and it's a virus which belongs to coronavirus family. And so what one of the most basic fact which we need to understand is that this is a virus which is spread by respiratory route. So if you understand it's a virus, you understand that how it's spread, then you understand how you can prevent the infections, right? So this one thing which we know right now is how the virus spreads, and the second thing is that we know that vaccines are really effective for this infection. So getting vaccinated is really important to break the chain of transmission, to make us and our families, safe from this infection. So I think this basically we very well understand that how the transmission occurs. We know that the virus mutates if it spreads more, so we have to limit the spread, and we understand that the vaccines are effective.
Thank you so much for your answer, Dr. Ujjwal. I would like to ask a basic question: that is COVID a surface infection or is it airborne? And what is the difference between the two, if you could just highlight that?
Well, so it's a very good question. And there has been a lot of confusion around it, right? In the news, you see that, COVID is airborne, and suddenly everyone is in panic. So let's understand first, how virus is, emitted out of our body and how it spreads, and then we'll talk about the modes of transmission. So the virus, when we speak, when we cough, we sneeze, we sing, the virus is emitted out of our mouth, and it comes out with some moisture with it. And usually the moisture, so the primary mode of transmission for this virus is called respiratory droplets. So when you're breathing or sneezing, these droplets are coming out of your mouth in which virus is contained. And depending on the size of these respiratory droplets, it can take varying amount of time. It can stay in air for varying amount of time. For example, the big droplets, the big size droplet, they settle very fast. They settle within few seconds to minutes onto surfaces. And so they are not in the air anymore. But there can be droplets which are like intermediate size. And those droplets can stay in air for a little longer. And then you can have very fine droplets, which we now know can stay in air for for a few hours, especially in indoor environments. So if there is a COVID positive a person who is breathing, speaking, sneezing in a closed environment, then these small droplets which can stay in air for hours, those can be inhaled, and their concentration can increase in a closed room, and then the other person can inhale those. I would say that the virus is primarily through respiratory droplets, which means that you need to be in close contact with someone and spend some time with them to get infected. However, in very closed environments, even if you are not in close contact with that person, you are like more than 6 feet away, you can still inhale sufficient amount of virus to cause infection. So airborne doesn't mean that it's being produced in the air. It's still coming out from some COVID positive person's body. It's just that it can stay in air longer indoors. So the same thing is not true if you are outdoors, because then because of the air, the virus will be like the concentration of virus will be diluted because of the regular airflow. So I would say that it's a good idea to keep your home ventilated if there is a COVID positive person in there.
Thank you.
Dr. Rathore, how does an airborne virus typically react when in water? This question mainly arises because of the recent incident of the bodies found in Ganga River. What does this mean for those living around those areas?
Yeah, it has been a total disaster in the last couple of months, a very sad situation, and we have also seen those pictures. But one thing I would like everyone to understand is that the chances of getting this disease from dead bodies is almost nil. Because you think about it, when someone gets infected, what happens is that the infection spreads into lungs, and then lung damage happens, and then the virus reaches to some other tissues as well. And it takes some time for the condition to go bad. And so a person, once it get infected, usually the death happens like after at least 10 to 15 days later, right? In most of the cases. And by that time, virus is already out of the body. So virus stays on an average, virus stays inside the body for around 7 to 9 days in most people. So if people die post infection complications. So infection happened, lung damage happened, then you are not able to maintain your oxygen saturation. So the secondary complications happen, and then someone dies. And by the time, virus is not there inside the body at all. So actually getting infection from a dead body, the chances of it are like extremely, extremely low. And then you think about it, then those bodies are either buried or are there in water. I don't think there is any real chance of getting infected. And in general, that it has not been shown that this virus can spread through water. It cannot, basically.
Thank you again for giving so much of insights on this pandemic and on the virus especially. So I would come to the double mutant strain that has spread now. So it is believed that this mutant strain is spreading through the lungs much faster. So considering that, if I am here in home quarantine, how can I ensure that the infection won't worsen the case?
So this what is commonly called as double mutant in the media is like scientifically defined as the Delta variant now, or it's called B1.617.2. So this particular mutant, which was first identified in India, we now know that its transmissibility is higher than previously identified strains. For example, previously identified strain which was first identified UK, which was more transmissible than the original strain. So this B1.617 is more transmissible even than that strain that we now know for sure. There is a hint that it might be causing more severe disease. There is not a lot of data on it, right? But it looks like that it might be causing more serious disease as well. So higher transmission likely to cause somewhat more serious disease. So this is, it looks like that virus is evolving, and we are finding mutants which are more transmissible. But the question is that what can we do about it if we're finding such new variants? And so first thing is that best thing will be to avoid getting that infection if you can. When the positivity rates were such high, for example in India, in many states, it's very, very difficult to avoid having infection, right? So but now, for example, now the second peak is coming down, And in that scenario, the positivity rate is coming down. So first thing you should do is think about not getting infected. And so what's going to happen now is that government is going to, because economy needs to come back to its usual track, government is going to open things slowly. So now the question should be, with such highly transmissible virus in circulation around us, and we still need to go out, we need to work, we need to go to work. So I think what becomes really important is, we as employers or employees, we start asking this question, how the environment can become more safe. For example, suppose your office has four buildings in there, and your office says that, okay, we are going to have even an odd rule, and then people only in one building are going to come one day, and people in the other building are going to come next day. But that doesn't, at the micro level, it might not help, because in the same building, you might have same 100% density of people, right? So if you sit, like 4 people sit in one nearby in one cabin, all 4 might be there on one day. So first thing, you have to reduce the density of people locally, right? So within that building, within each block, people should be like this, away from each other. They should still be wearing masks. They should be eating away from each other, right? And until when should they do it, right? The question arises, until when can we do? You feel like having lunch with your friends, right? It's like, it's been such a long time, we were in a lockdown, and now I'm back at my office, and I want to gossip with my friends, and I want to remove my mask and see their face. So, but you have to be a little patient about it, right? And the question is, until when? The question is, until most of your friends, or any people around you who are vaccinated, right? You have to actually maintain this distance a little bit to save you and your family. And you need to talk with, for example, your employers, your office staff, and the people that all these rules are meant to keep us safe. And if we just think about, even and odd in terms of, for example, having in Chandni Chowk 2 shops, they're saying that we are going to do even and odd. But on one shop, if there are like 150 customers at one point of time, it doesn't serve any purpose. So first thing is how to protect yourself, but if you get the infection with this virus, that was the question, right? So
Yes.
what can you do?
Yes.
So once the virus is inside the body, it all depends on how your body reacts to that virus and how your virus reacts to that body. There's very little. So the first thing you can do is watch your symptoms, right? So you have to be very, very careful about watching your symptoms. You should not. So there are 2 things which you should do. You should not panic. And because if you will panic, your doctor will also panic, and they will overdose you with different drugs. And because doctors also take cues from their patients. Sometimes if you are saying that, oh, I just don't feel good at all, although you are okay and it's mostly anxiety, right? The doctor is going to give you all the possible drugs. And the second thing is that you should not take it too lightly also. So you should, like, for example, not monitoring your oxygen levels regularly can be a big mistake, because if this virus can cause more severe disease, then in that case, your symptoms can appear suddenly. So in that case, it's a good idea to regularly monitor your symptoms, and develop a system where so the thing is, now when the disease was at its peak, hospitals were completely full, but now it might be possible to get medical help. So you should have a plan of action. So once you get infected, that this is basically this is the person I'm going to call, and this person is going to call this doctor and this hospital in case my condition gets worse. So just plan for, the situation's good or bad. Don't panic. Don't get too much relaxed as well.
Thank you so much. This was a lot of insights and a lot of information that you have given to our audience today. Thank you so much for that.
Right. This, I think, so is very important, that you should not take it very lightly. This disease is not to be taken very lightly. On that note, my next question will be: are there any evidences that there can be reinfection? And if there is a reinfection, will that be severe or it will be moderate?
Okay. Yeah, it's a very good question, and very important too, because if reinfections are not possible, then why do we need vaccines for people who are infected? And if reinfections are possible, then what's going to happen when reinfection is going to happen, and who is going to get reinfected. So I would say that reinfections are possible. But they are exceptionally rare. They are very rare. But this might change. If we get, if the infection spreads uncontrollably and more mutants arrive, which can. So when someone was already infected and they get a second infection, it's called breakthrough infection because it's breaking through their immunity. So these breakthrough infections, we know. So the numbers varies from country to country, from studies to study, because different variants are circulating in different countries. But I would say that it's close to 5-6% chances of reinfection in the current scenario if you were already infected, and it changes. When when was your infection? How long ago your infection happened, and it can also change with your age, your immune system. So, but it's rare. However, it's possible. So because it's possible, and so what happens is when people get infected, within like 10-15 days, they start making antibodies against the virus, and then antibody levels increase, and almost everyone within 21 days of getting infected have some levels of antibody. But after a few months, the antibody levels start to decline. And in most of the people, they are maintained pretty well for a year at least, because we have data for at least a year right now. But in some patients, they decline more faster because of their age, because of other comorbidities, other conditions. They are immunocompromised, they are on cancer treatment or something like that. And so what we know is that actually, if you have an infection and you have some antibody response, some immune response, and you boost it with the vaccine, then it becomes more long lasting and it matures. Your immune response matures, so it can tackle more variants. So that's why even after getting infected, vaccination is required. And that's why I would say that don't think that because you were infected, now you can just be a hero and remove your mask and be in a very crowded place, because you don't want to get infected again, even if it's mild. And so in most of the cases, it's mild if you get reinfected again. And then we know that for this disease, we have like a variety of symptoms in different patients, right? So you would still not like to take chances and try to stay still safe.
Yeah, thank you. And a reminder to the audience that please do not stop wearing masks. Masks are absolutely necessary. Please do not go out without wearing mask. So I would like to ask you another question, Doctor. What is long COVID and how should we treat it?
Yeah. So as I said, that in case of COVID, the symptoms can vary from patient to patient, and that's the main problem, right? Even so, in India, at a lot of time, I'm seeing that the patients are given a lot of medication, and for varying degree of duration. And the reason for that is different patients have very different symptoms. Sometimes doctors are also confused what to do with that. And so, what's long COVID? Long COVID means that normally, in most COVID patients, what happens is that COVID symptoms are resolved within few weeks. I would say like 4 weeks, for example. Like after 4 weeks, you start feeling much better and your strength comes back. But in a lot of patients, it's seen that they can have like fatigue, breathing difficulty, cough for months. So some patients like 3 months, 4 months. It can go on for 3 to 4 months. So this is called long COVID. And we don't really understand, why in some patients it goes on for such a long period of time. But what we understand is that for the mild, if the symptoms are mild, for example, the symptoms are that you feel tired, you feel that sometimes you have headache, you feel that sometimes occasionally you get low grade fever, like 99 degrees or 99.5 degrees, and sometimes you get low grade fever. That it's not very uncommon. So what I'm seeing is sometimes what happens is a patient gets fever 1 month after getting COVID, recovering from COVID, and doctors start steroids once again, which is a big mistake, because you do not need such steroid kind of drugs for treating fever. What you need is to give paracetamol for fever, right? Because this only symptom is fever.
Yes.
So, but we don't really understand why it goes for such a long time in most patients. And I would say that what you need to do is basically general whatever things you like in ideal scenario would like to do to maintain good healthy lifestyle, which is nutritious food, proper rest, proper sleep, and have a schedule. And then, once you feel like you have some strength, you should start doing a little bit of exercise, very mild exercises, so that you are not completely bedridden and you feel lethargic because of that. And try to not be on unnecessary medication during long, because it's not a good idea to be on some medication for 3 months, 3 months period of time. Some of these things resolve itself with time.
Thank you.
My next question will be, one of our members is living in an apartment, and they say that their neighbor is infected and they are not properly following the COVID appropriate norms. They are not wearing masks and all that, coming in balcony. So how do they ensure that they don't get infected in this scenario?
Very difficult situation. But I think what they can do is, they can't control their neighbors' behavior, but they can control their behavior, right? So I would say that maximize their distance from them. As I said, that because the virus can stay in air, especially indoors, for long durations of time. So avoid being in, with such person in like closed environment. As far as standing in balcony and, I think what they're going to, exhale there, it's going to, be just blown away by air and spread across. So the concentration is not going to be that high. But if you're concerned, when you go to your balcony, you wear a mask at that time, right? So at least, so you have a barrier, you have additional layer of protection. So because then 6 feet distance criteria doesn't come in, like it's not sufficient when someone is infected and they are not wearing a mask, they are not taking precautions. So you need to maximize the distance in that case and stay away from them.
That's a really good point that you made, Dr. Ujjwal, that we have to be cautious and we have to take the precautions. If others are not taking, at least we should do it, for our own safety, right? So now Indians, in the Indian psyche of self-medication is very popular. We have these gharelu nuske, dadima ke nuske. So what do you think, is self-medication a safe option when it comes to steroids, considering that most COVID prescriptions look identical? So can we just say, okay, my doctor or somebody else's doctor prescribed a certain medicine, I can also buy that medicine and take it if I have COVID later?
Oh, you should absolutely not do that, and I'll explain why not. Because just think about it. See, there are two things. First thing is medicines, right? You are saying that everyone is roughly getting prescribed the same medication, but not everyone is same, right? Because medicines work differently on different people. And I'll give you an example. For example, someone is getting steroids in a hospital setting when their oxygen saturation is below 92% for 5 days at right dose for their body weight, for their condition, looking at all the parameters. And now you start giving it to someone who is diabetic at home, or someone who doesn't know they have diabetes, right? And steroids, what they do is they increase the sugar level. So your insulin shoots up. And because you are doing self-medication, you don't even know that I should monitor my insulin levels, or you are not aware of that I have thyroid issues or something else. And, so I should not be. So the combination of so this is one point, right? Because same medicines might be prescribed to different people, but you are different from other people. Everyone is different. Everyone's immune system is different. Everyone's health is different. Everyone's age is different. So strictly avoid self-medication. But apart from self-medication, the question is also avoid unnecessary medication, right? And it's difficult for an individual to understand what's unnecessary and what's necessary. When doctors are finding it difficult to understand what's necessary and unnecessary. We should have had more better guidelines which medicine should be used, when they should not be used, for how long they should be used. And the guidelines are changing, but either guidelines are not changing at the sufficient pace, or they are not being communicated very well to people. So I would say that doctors are already over medicating people, and people also start self-medicating, and then it's a big trouble. What I would say is that it's important to understand that in majority of COVID cases, close to 85% cases, the disease is usually very mild. By that I mean is that you do not develop respiratory symptoms.
Okay.
You do not get chest compressions. All you get is cough, fever. Fever can be sometimes intense. You might have for a long time. For example, the median time for fever in COVID is like 12 days. Sometimes what happens is people have fever for 6 to 7 days, and then they think that, oh, it's been already 7 days. My fever is not reducing, and it goes down only when I take paracetamol, but then it comes back again. and probably I need more stronger medication now to control this, right? And that, even doctors think that's like that sometimes, but that might not be true, right? Because so we have to look at data, right? The people, so what people do is they ask their neighbor, oh, so you got COVID 1 month ago, and how for how many days did you have fever? And that person says 3 days. Like, oh, 3 days, and I already have it for 7 days. That doesn't sound right. Like, let's do something about it. And and then they start medication, right? So but then drugs like steroids are extremely dangerous. I would not even go there. That you should never attempt to take them at home. Even when doctor is prescribing steroids, you should ask your doctor, why are you prescribing it? What's the reason? And is it advisable to be prescribed at this stage of the disease for this much duration? Is this dose? So you should ask these questions. And like, even so I see people, not just steroids, people are taking antibiotics themselves. So when and we'll come to this probably later also, but like antibiotics, don't take unnecessary antibiotic. It's a viral infection. You are expected to have cough. You are expected to have respiratory symptoms. You are expected to have fever. But it's a viral infection. Antibiotics are not effective for bacteria. Bacteria and viruses are two different types of microorganisms, and the antibacterial drugs do not work on viruses. So it's not useful to have antibiotics, and they have a lot of side effects.
So one more tip to the audience members: please do not adopt self-medication. Please avoid self-medication and consult a doctor when you have certain symptoms. Yes.
Yeah. I think so. I will tell them ki watch Ujjwal Bhai's video on this only in his YouTube channel Virus Dunia. He has made a beautiful video around how to take medication, when to take, and why you should take a medication. Moving on, post-COVID symptoms are something which most of the people are experiencing. What are some of the symptoms which one should be worried about, and some which one should not be?
So the symptoms which one should be worried about even after recovery from COVID are similar to what one should be worried about when they have COVID. So the first symptom is you keep on monitoring your oxygen saturation level for a few weeks after you recover from COVID. Because it's like it's a lung infection, right? And there is lung damage in this disease, and sometimes that might not manifest itself completely within your hospital stay time or when you are actually actively infected with the virus, but it might take some time for the condition to get worse. Mostly it improves, but for other reasons, and it might get worse later. So oxygen level, monitoring your symptoms is equally important afterwards as well. Most important symptom is oxygen saturation. Then breathing difficulties, right? If you are getting breathing difficulties, then other symptom which you need to watch is bluish lips. If you are getting bluish lips, blueness on face, or your hands and feet are becoming very, very cold suddenly, because then that also indicates that oxygen supply is not proper in your body. Other thing which you need to watch really is that any kind of chest pain, severe chest pain, compression. In a lot of cases, people are getting heart attacks after recovering from COVID. So familiarize yourself with what heart attack symptoms look like, and if you have severe chest pain, don't take it lightly. Then you basically go to a healthcare center and just let them check and do a checkup. And I would recommend that once you recover from COVID, and possibly around a month afterwards, you should probably get a full regular medical checkup done, your blood profile and everything, so that you just know what if there's something which is particularly wrong in your blood profile.
Wow, that's great insights that we have got on post-COVID symptoms. So I would again, when we come again to the medication part of it, multivitamins are something which the doctors have generally prescribed to boost our immunity. But sometimes what happens is overuse and long-term administration of these multivitamins can cause other complications in our body. So what do you suggest? Should one use it for, and if yes, for how much time?
First we need to understand why this use of vitamins and how it started, right? In case of COVID, why people started prescribing it, or why people started taking it. So last year, when the pandemic started, all kind of studies were done, retrospective studies in which this was scientists went and checked who was getting what medication and whether the symptoms were more serious or less serious, and try to figure out a correlation between if you're taking this particular medication, whether your symptoms become more serious or less serious. So there was some initial very small scale studies which showed that some of the vitamins might help. But now more extensive, big studies and clinical trials have been done, which show that there is no benefit on taking any of these multivitamins and, for example, like vitamin C and all these things. So I would say that please do not take unnecessary multivitamins. And like some people have vitamin D deficiency, they have proven known vitamin D deficiency. So they can continue taking their vitamin D as prescribed by their doctor. But if you are taking, for example, vitamin C for 3 months, 4 months, you can have, you might increase your risk of having kidney stones. So everything has everything has, if taken unnecessarily, has some side effects, right? Unnecessarily, and during COVID, people are already taking multiple medications, right? You combine that with all these extra multivitamins together, these things are not probably very good for your health. I would say, if possible, take nutritious food, and your body will absorb whatever is required from that, after digesting that food, and that's the best way to do it. Do not take unnecessarily zinc, vitamin C, and it's very difficult. I'm saying that do not take all these things, but like doctors are writing these, right? Doctors are writing. I sometimes get these prescriptions in which like more than 15 medications are recommended to one patient, and once the number of medicines go above 4 or 5, you need complicated algorithms to figure out which combinations are going to have harmful effects or not. A doctor cannot actually predict what's going to happen with so you take 2 drugs, you can study they will interact with together this way, they are not going to be harmful. You make 3, it's become difficult. You do it 5, it becomes even more difficult to predict what the effect is going to be. So I would say that this is something which our regulatory bodies and government need to also look at and make fresh new guidelines, and just make sure what are the drugs which are really required and who should take those. You also asked me in the last question that what about people having these home remedies which are like Ayurvedic drugs, or so it's not just about the drugs which are coming from modern medicine, which you should avoid unnecessarily taking. For example, not just multivitamins, but even, for example, our local home remedies, right? You should unnecessarily not take those as well, because they have some effect, they have some active ingredient in them, right? And for example, what is happening a lot in some states in India these days is people are drinking a lot of kadha. And that the kind of ingredients it has, it's very it can give, if you consume it for like 2 months continuously in hot weather, you might get stomach ulcers, right? And who likes? No one likes stomach ulcers. They're painful. So do not start medication thinking that I'll take, for example, vitamins, multivitamins, or kadha or something else, and this will protect me from having COVID. There is only one thing which is going to protect you from having COVID, and as far as drugs are concerned, that's vaccines, right? So if you want to take something to make your immune system stronger, then specific thing is vaccines, and the other thing is to take better care of your mental and physical and social health. So you protect yourself from getting infected.
Thank you.
Dr. Ujjwal, this is an increasing concern in India especially. I want to know why it is that there are different kind of fungus, different color, they are coming up. Why it is very unique to India and why it is happening.
Yeah, I'm glad you asked this question. A lot of people, I'm getting questions about this issue a lot. And people are really worried, and rightfully so, about these emerging fungal infections. So let's get into the basics of this first. So fungus is all around us. Different types of funguses. We are giving them these terms: black fungus, white fungus, yellow fungus, because, like, for example, what we calling black fungus is mucormycosis infection, which it turns tissue when it infects the tissue, and the tissue is dead, it turns it into like blackish color, and that's why it's being called black fungus in the media. So, similarly, with other white fungus, you get like your tongue might appear white, so it's being called white fungus. Although the fungus itself doesn't look black or something, the fungus is transparent. The black fungus is actually kind of translucent. So fungal infection, fungus is all around us, and we usually do not get infected with fungus because our immune system is pretty good at getting rid of fungus, especially from lungs. It clears them pretty fast. So despite having fungus inside our body, around our fruits and rotten vegetables and everywhere, we don't get fungal infection. So now who gets fungal infection usually? People who are immunocompromised. If their immune system is not working properly because of cancer therapy, because of various other reasons, diabetics often, when their sugar levels are very high, the immune cells in their body, they become less efficient in getting rid of fungus. And then sometimes you have cell damage and tissue damage. So when there is a tissue damage, it's easier for the fungus to infect that. And diabetics also have often organ damage and other kind of damages in their body. So the fungal one thing we understood is that fungal infections are usually not common. They can happen usually only when you are immunocompromised. Your immune system is not working properly for whatever reason. Okay. Now the question comes is, why suddenly all fungal cases? Why mostly in India? Right? Why we are not hearing this from other places? So fungal infections in COVID setting were reported as early as last year mid, and they were happening in other countries as well, but not at this frequency at what we are seeing here. So there's something different going on here. So what's that? Let's understand that. And fungal, so across all the countries, Europe, US, India, other Asian countries, fungal infections with COVID are going on, but we are at a different stage altogether. And so in general, the cases of mucormycosis, the fungal infection cases in India are much higher than rest of the world. They are like, for mucormycosis cases, a study which was done around a decade ago showed that mucormycosis cases are like 70 times higher in India than in other countries in general. And one possible reason for that could be, like one contributing factor could be that we have like second highest number of diabetic people in India. So like 10% of our adult population is diabetic. And as I said, that diabetes makes you high risk for fungal infections. So even people, like, I would say that people who are just above 30, like close to 10% of those are diabetic, even if they don't know it. So this is another thing, that a lot of people in India who are diabetic, they don't know that they are diabetic. So they don't know their sugar status. They don't know that they are not maintaining sugar. So when such people get immunocompromised because of the viral infection or because of the drugs which they are getting. So like one primary reason, again, which comes to is the misuse of drugs in India, which is steroid overuse and antibiotic overuse. So a lot of people are talking, you must have heard it in media that steroid overuse is causing actually this rise in fungal cases. And so what happens is, how steroids work is, steroids are a kind of drug which suppress your immune system until when you are taking those. So what happens is, then in case of COVID, when someone gets infected, initially the virus is there, virus is going to lungs, causing damage. And it's, as I said, it stays there inside for your body for 7 to 9 days. But then virus is out of your body. And then sometimes after 7 or 8, 9 days, when you see that the oxygen levels are going down and still, health is still, getting worse, then what you realize is that probably now virus is out of the body. Virus is not doing this. Our body, our immune system is trying to fight the virus, and it's overreacting. It's causing self damage. And that's the stage when the oxygen levels are below 92%. You say, okay, let's give some steroids, low dose steroids for around 5 days, at max 10 days. And so all those doses are like defined internationally, what should be the dose. And you give it for that short period of time. And then you basically suppress immune system for a very short period of time so that it stops overreacting, and you suppress it mildly. And then, the person, obviously the virus is already out, immune system is slightly suppressed, the person recovers. But now think about it, the person is diabetic, already prone to fungal infections. Now he is given steroids for much longer period of time at the wrong time. For example, started on the first, too early, or, given to, for like 20 days, 15 days, or given very high dose. So immune system is really suppressed. Now the fungus is all around you. Right, and it's going to the fungal spores. So fungus make these like spores. Spores are basically a kind of particles which can survive in very harsh condition and can be spread through air. So there is the fungal spores come, and now such immune suppressed diabetic patient inhales those spores. So then the fungal infection is going to happen, and once the fungal infection sets up, it has a very high mortality rate, some 50 to 80% mortality. So every second person, or 2 in 3 people are going to die if they get the fungal infection. And the reason for that is because the fungus is different from bacteria and virus. It's more similar to human cells. And so it's difficult for fungus to infect us, but when it infects, you don't have many treatment options, surgery and a couple of drugs. You have to give those drugs for a long period of time, and then only you can treat this. So what I would say is that if you were on a steroid therapy for a long period of time and you're back home, you just take care of, in general, little bit of cleanliness around you. Because you're immunocompromised, you're diabetic. Otherwise, it's not that important. There's no need to keep sanitizing everything around you. But what I'm saying is, if you are diabetic, you are on steroid therapy for a long time, you need to be careful about wearing mask or sometimes. So for example, it's coming through sports, right? So you inhale the fungus in, it goes through your nose to your sinuses and reaches to your eyes. And once it reaches the eyes, eye has to be removed, because otherwise it can reach to the brain. And then, there is basically, once it reaches to the brain, there is very low chances of survival. So what if you, suppose you're at home, you know that I was on steroids, I am on steroids, you just keep continuing wearing mask, a clean mask, okay, which is regularly changed, or if it's a cloth mask, washed. And so then you decrease the chances of inhaling those spores, and you can probably better protect yourself. But I would say the first thing should be, when your doctor is prescribing you steroids, just ask him, are these according to the recommendations? Because my oxygen saturation is 98%. And according to the guidelines, it's not recommended if it's above 92%. So why are you prescribing these steroids? I have been already recovered from the disease. Why you're prescribing the steroids? If your doctor doesn't listen to you, take second opinion.
Correct. Thank you. And I think this is the whole process of fungal infection that you have told us. I think it is a very scary thing, and people should be conscious and they should be aware, and I think this kind of awareness was required. So thank you so much.
Yeah. I would like to add one more point for this fungal infection thing, which is that, because you said it's very scary, it is a scary thing. But I would say that most of the people who have good health, whose immune system is not compromised, they are unlikely to get it. So it's always going to be little rare. People who need to be extra careful is who had like long steroid treatment, or people who are diabetic. So if I have to give you statistics, I think that close to 80% of the people who got fungal infections were diabetics, and 76% of those people were on steroid therapy. And then the other thing is that so everyone is talking about fungal infection and steroids, but people are not talking about antibiotic overuse and fungal infections. So in general, in India, we give antibiotics like we are giving Chyawanprash. We just give it like anything, whatever happens. You go to a doctor for anything, and he just gives you will give you a fever medication and antibiotics, right? And which antibiotics have so many different side effects. So, but specifically in this case, it's a viral infection. I have seen patients coming who ask me that, we have finished antibiotic courses 3 times, like 5 days course 3 times in the 20 days of COVID period. And when you ask those doctors why you're prescribing these antibiotics when it's a viral infection, when the person doesn't have just fever and is general tired and nothing else, very mild symptoms, and they say that we are giving it as a precaution. And it's not a precaution, because what you do is, when you give antibiotics, you kill antibiotic sensitive bacteria. And now the place is empty. Now antibiotic resistant bacteria can come and cause very serious infection. And it has been shown by research that a lot of these infections, like Candida fungus infections, these infections are increased with overuse of antibiotics. So antibiotic overuse can also result in, and antibiotic overuse is like what is happening in our country is, it's like I can't tell you how much it is overused, the antibiotics. So I think we should, and so I have seen people who insist, who might tell this that you don't need antibiotics because symptoms are very mild, but they insist on getting antibiotics because they're like, okay, our fever is not going down, we want antibiotics, but it doesn't do anything. It's just one more drug in your body.
Thank you.
It does harm.
One more question, Dr. Ujjwal. You said overuse of steroid. Is it the normal course of 5 days you are talking about, or the course which exceeds that? That is.
So overuse of steroids, I'm saying that one thing is when it's not required. So the 5-day course is also not required in all the cases. It's required only in those cases where your oxygen saturation is below 92%, and it's been more than 7 days since you started getting symptoms, and you are hospitalized most likely, because then they can monitor your sugar, because sugar levels, and they can start insulin if required. So one thing is that unnecessary use. Other thing is overuse. So overuse is happening both ways. It's happening, people are getting it for longer durations, and they are getting it for a much higher dose than what is recommended. Because Indian guidelines, even the recommendations are, much higher than international recommendations for steroids, and I'm not sure why that's the case.
Thank you. Thank you. And now I would come to the development of vaccine. So this is a very hot topic of debate. I have gone to various conferences and I have heard about this. So usually they say that it takes 8 to 10 years to develop a vaccine. But if you see in the case of COVID, it has rapidly, approximately, I think it has taken a year to develop the COVID, the vaccine. So, what could you share how your thoughts on how it is possible to compress such a long time of duration of research and developing the vaccine? How can it be possible in 1 year?
Yeah, it's a very very important question, because people sometimes doubt these vaccines because they think they were developed too fast. So probably something important was skipped, some important step was skipped, and they don't know what step was skipped, but they think that something must have been skipped because it was done so fast. So one thing, the first thing is that we were lucky that this was an infection which was not by a completely new virus. We knew other viruses from this family. So in 2003 SARS came, right? And SARS was also a coronavirus. And in 2013, then again, MERS infections emerged in Middle East respiratory syndrome viruses. And they were also pretty similar. Especially SARS was very, very similar to SARS-CoV-2. And that's why it's named also in a similar way. So the SARS virus was also a virus which had like similar shape, with spikes coming out from there. So spikes are those cricket bat kind of thing coming out from. You must have seen those pictures of the virus, right? Baseball bat or cricket bat, and so those are the spikes, right? And so the spike protein is the important protein which is used for vaccine development. And each protein has a three-dimensional shape, and basically the three-dimensional shape tells you how to design vaccine for that particular thing, because its shape is like this, then how it's going to work. So we were lucky that SARS, people were doing research for 17 years on SARS virus. So they had understood a lot of basics about the spike protein from SARS. They had already designed vaccines for SARS, but there was no way you can do clinical trials on it because SARS just disappeared, right? So if you don't have patients for that, how can you do a clinical trial? So, but they developed, so methods were developed. We understood how the virus spike looks like. If it would have been a completely new virus, the initial research phase itself would have taken few years. So that because 17 years of research first helped. So that was the first thing, right? First step helped. It was not a completely new thing. So already people knew how to make vaccine candidates from that spike protein. So that helped. The second thing, one of the biggest hurdles in such vaccine development efforts is regulatory time. How much time it takes to get regulatory approvals. But that was expedited, right? So sometimes what happens is that you generate some data, you do experiments. For example, you do some animal studies. So how you test vaccines? First step is preclinical studies. So in preclinical studies, you test, vaccine. You put these vaccines into animals, small animals, and then they generate, these antibodies, and then you take out their blood and check whether the antibodies can actually, stop virus from doing infection. And then you go to non-human primates, do experiments in monkeys, and then you figure out basically. Even in those, if you do vaccination and you challenge them with virus, it protects, right? So these are preclinical. So what happens is that previously you do preclinical studies, you submit it to a regulatory body, and then they will sit on it with 4 or 5 months when they get time. They will read it and they will keep discussion back and forth. Now what happened is everything else was kept aside. This was the first priority, right? So those agencies, they were like, okay, you are giving it to us. Instead of reading it after 1 month, we are going to read it now. And we are going to read it, and we are going to, take whatever time it needs. We are going to give it to more experts so that we can read it faster. We are going to consult more people, right? So you reduce time, you consult more people, you become more confident in your data, and then you give approvals fast. And then the most important thing which reduces the time for clinical trials is, so what happens is in a clinical trial, what you do is you give vaccine to suppose 20,000 people, and you give a placebo. Placebo means you just, give something which there is no vaccine. It's just kind of just water. You give water to, remaining 20,000 people. And then you see how many infections are happening in people who got vaccine and how many infections are happening in the control group. So suppose an infection is spreading very slowly. You will not get infections in any of the groups, right? And so you will not get the mathematical power to say that, oh, this vaccine is working. But when infection is going very fast, your testing process becomes fast. because you figure out that in the control group you have got 1,000 infections, but in the group in which you give vaccine, they're like 2 infections. So like, okay, this cannot be by chance. We have statistical power to tell that it's working, and we don't need to wait for 3 years for this. So for example, Zika, Ebola, you want to test their vaccines. How will you test? There should be an outbreak, right?
Yes.
And that's what makes it take more time. So scientifically, none of the steps were skipped. All the steps were taken care of. It's like the time which was like in formalities, other things, that was reduced.
Thank you. Thank you.
Uh, Dr. Ujjwal, there are different technologies in which vaccines are made. So, for the first time, we heard this new technology, mRNA, messenger
Yeah.
RNA. So, how it is different from other vaccine technologies, and is this the future of vaccine manufacturing?
Yeah, very nice question. So mRNA vaccines, although not available in India, but are being heavily used in many countries across US, Europe, and many other countries as well. And I would say that mRNA vaccine technology was there for a long time, and it was being developed for multiple diseases like Zika, by Moderna, and also for cancer. Making vaccines against cancer. And what was going on, but they were not in phase 3 clinical trials, or were not in use. They were in phase 2 clinical trials for many diseases. And now we found that actually they are very effective because they are used for COVID-19. So mRNA vaccines are it's a very amazing technology. And how it works, to understand that, let's understand a little bit of basics of. So our DNA is like a recipe book. Okay. And each gene in that our genome is like a recipe. And that what does recipe actually makes a dish. Each recipe makes a dish which is called protein. So proteins are real action molecules of the body. They do whatever work is done in the body. For example, we have proteins in our eye which catch light, and because of which we can see. So proteins are actual action molecules. DNA is basically the code. It's how the information is coded. But there is something in between this recipe and dish. And that's what is mRNA. It's called messenger RNA. So suppose in the recipe book, the recipe is written in Chinese, right? And you want to make a dish and you don't know Chinese, then you can't read it, right? So you need a translation in between. So the mRNA is between DNA and protein. So mRNA is basically the translation of the Chinese recipe. So once it's translated into, for example, English, then you can read it and you can make the protein. So mRNAs make proteins. And so these vaccines, what we do is we just take mRNA, which actually makes spike protein of the virus. You put that into the body. And how you put it, mRNA is very unstable. If you put it into the body just like that, it will get destroyed before entering into cells, and it will not have any effect. So what scientists do is that take this mRNA and they encapsulate it in a lipid. So, and that when the lipid protects the mRNA, and you put it into your body, and the lipid and mRNA enters into cells, and then your cells make the spike protein of the virus. So you are just putting a small fragment of mRNA, which you can very easily make in manufacturing units and factories, or biotech companies. Very easily you can make it, and so and then you put it in there, and your body makes the protein. And that mRNA, because I said it's unstable, so once inside the cell, within few hours it's gone. So it's just gone. But your body made some spike protein. Your body then generated antibody against it. So I think they appear to be very safe. They are very easy to manufacture, and there's a huge potential to in the future to make them much cheaply. And you can quickly, for example, there's a mutant virus coming. You can just change some code of the mRNA, and now you have a vaccine ready for the variant. So it's very easy to adapt it to emerging infections. So what I think is that in the coming future, mRNA vaccines are going to be much more popular and more widely used. It's a big leap in our vaccine development.
Thank you so much, Dr. Ujjwal. And I see that our audience on YouTube is finding this conversation very interesting, and they have asked a lot of questions. So now we go to the audience questions.
Okay.
So the first one is, if we have a brief contact with a person who is COVID positive, now how fast can this virus transmit? And considering that we are in contact with the person considering that we order home online food for home delivery, Suppose one
Yeah.
of the delivery persons has
Yeah.
COVID positive. Now, what do we do?
Yeah, I think so. Basically, we are trying to understand what's high risk, what's low risk when we are meeting people. And I would say a lot of people are worried about when they order food and the delivery boy is coming and giving you food when he's also wearing a mask. You are also wearing a mask, and he gives it to you for in few seconds. And you take your pizza and or whatever biryani, and you go inside. And people are worried about it. But when they go inside, they have called three more friends, right, who are coming from different households, and they are removing mask and eating that biryani with them, or so that's more high risk. So I would say that when you are meeting people who are masked and you are masked, and you are meeting them for short duration, it's not high risk. High risk is unmasked meetings. So, and people do it mostly with those people with whom they trust, right? So you do it with your family members, you do it with your friends. You are not going to sit with a delivery boy and talk for 15 minutes, usually not, right? Unless there is some issue with your order. So I would say that you need, normally when a person is speaking, you need at least close contact for a few minutes to get infected. I would say like 10, 15 minutes talking without masks. Or at least one person is not wearing mask. Even that makes your protection less, right? Even if you are wearing, the other person is not wearing, even then it's high risk. So, but if you are just, collecting some stuff from here and there, and then it's not, and especially if you are wearing a good quality mask, it's not very high risk.
Nice. This is a nice input. Thank you.
uh, Dr. Ujjwal, I think so. Some of the members here are worried about some of the symptoms they are having. So one of the
Yeah.
members asked that one of their family member is having fever even after 1 month of getting a negative report. The fever is around 99, but is it worrying or is it a case of long COVID or something like that?
It's a symptom of long COVID, and I would say that if fever is giving them discomfort, then at that point of time they can take fever medication, to bring the fever down. But I would say that don't start antibiotics or steroids for such fever. This is a symptom of long COVID. It can. So I think we don't understand really why this happens, but the possibility is that there are, like, for example, the virus is out of the body, but some virus, like parts of the virus, might still be around somewhere in some cells, and body detects those parts and it elevates temperature again because it's detecting something is from coming from outside. It's not a new infection, but that's how body perceives it. But then it doesn't see more of it, so it comes down again, and then again body detects and it goes up. So it's a symptom of long COVID. I don't think anything people need to be really worried about it.
One or two more symptoms they have talked about. One is burning sensation in palms and sole. They are even after getting negative report, and so
Yeah, so this is something I have not heard a lot, like burning sensation. This might be, I'm not sure what other medications they are on. I think they should go and see their doctor. This is not a common symptom for long COVID. They should go see their doctor.
uh,
And
one more. One of the member asked is, are there any more bacterial infection apart from the fungus and are there any other kind of bacterial infection which are coming?
So once you are on, very heavy antibacterial or on steroids, once you are on steroids, basically, your chances of getting any other kind of infections increases. And that includes bacterial infections, fungal infections, all chances of getting all these infections increase. So that's why it's important that, so I'll tell you, like in most of the COVID cases, secondary bacterial infections are very, very rare. So there is no reason behind starting antibiotics in COVID in the beginning. If someone is hospitalized and they're in a hospital, there is chances of them getting bacterial infection from the hospital, or when they start steroids, doctors start antibiotics at that time, because once you are on steroids, there are high chances that you can get other infections. So then they start antibiotics. So, but when you are not on steroids, when you are not in hospital, avoid having antibiotics to prevent getting bacterial infections.
I would like to like we talked about the development of vaccine, right? So
Yeah.
it is also in the news, and also I have heard from people that the effect of the vaccine stays only for around 9 to 10 months. So what will be the situation after we complete 9 to 10 months? And for people who have got that two double dose of vaccine, what will happen after the 9-10 months are over?
I think it's not true that the effect of vaccine stays only for 9 to 10 months. I think when you have only data from 9 to 10 months, then you can just tell about that it stays until 9 to 10 months. So now we have data for almost a year since vaccination started, like the trial started, and we know actually vaccines are effective at least for a year. My In my experience, I think for this particular virus, the immunity should last for years and maybe decades. And the only way we might need an additional like vaccine booster, like apart from 2 doses, is that if we don't vaccinate our population quickly enough, and then more variants emerge, some of which actually make these vaccines less effective. Till so far, vaccines seems to be working on all the variants, and so the cases of severe disease and death reduced by disease by all the vaccines for all the variants. But I would say that vaccines are going to be effective for a long time. And in worst case, we might have to take another booster, basically.
And another question I would ask that is this the new normal, or we'll go back to our normal life? And how much time will it take?
We will go back to a normal, like, for sure. And for how long, that will depend on how fast we can vaccinate our country. Because as I said, that what's going to happen if we don't vaccinate, we will still have breakthrough infections, like people getting so what can happen is, suppose if a person was infected and then that person gets infected again because the new variant came, and he still might have mild symptoms, but then the person goes home and his parents got infected who were not infected before, and they are old age or they're diabetic, right? Then they might end up getting severe disease and they might get into the hospital. So we might keep on having these outbreaks, big outbreaks, if we are not, we don't vaccinate our 70-80% of population, or small outbreaks in those communities where the vaccination is not being done. For example, I'll give you Israel. Israel, or in the US where I am right now, we are actually allowed to go out, have dining with friends. All vaccinated people can actually, by guidelines, if everyone is vaccinated, they can have a party together. And that's because they know once you are vaccinated, and the infection rates are very, very low. So the infection rate in the city where I live in San Francisco are like 2 in 100,000. So 2 cases in 100,000 people, and that too mild. Right. So then the life comes back to normal. So I would say get vaccinated, motivate people to get vaccinated, and then your life will come back to normal.
So here's the message from Dr. Ujjwal. Please get vaccinated. Don't be scared and don't ignore the vaccination. Don't listen to rumors, and please get vaccinated.
Exactly.
So one more question, Dr. Ujjwal, that some of the people are not trusting the government vaccines which are provided now and waiting for other vaccines, maybe Sputnik, or as Pfizer is also in talk. So maybe those will come, but these are available. So what they should do? Take these vaccines or wait for the others?
Very good question. I'm glad that you asked this. It's like, so people, these days people are talking about, they're using this word a lot, efficacy, right? And they come and ask that this is 78% efficacious, this is 81%, and Sputnik is coming, it is 90%. So we will wait for Sputnik and we'll get that, or we'll get Pfizer from, somewhere, and so now the question arises, suppose I tell you that I have, I know 3 kids, and one of them got 90% marks in exam, other one got 80%, other one got 78%, but one gave ICSC, one gave CBSE board, another was state board. Then you will tell me that because their 3 boards were different, their marking style was different, done at different times by different teachers, their marks can vary. But let's look at what these kids know, what they can do. Suppose if we are hiring someone for a job, like an engineer, right? And they have got different marks in ICSE, CBSE boards, or whatever their engineering college was. But when you put them to do code, and then all 3 of them can do coding really well, but one of them can join 3 months later, and the other person can join 2 months later, and one can join now, and you have a project for which you need to hire someone, otherwise you lose a lot of money. You will hire the person now, right? So same thing for the COVID vaccines. If you are getting a vaccine, so I always say the race is between COVID virus and COVID vaccines. You wait for 2 months. So I know people, I know friends who are waiting to get a vaccine, thinking that we'll get Sputnik, or we will basically, Covishield is available, when we'll find Covaxin, or vice versa, we'll get that. And in between they got COVID, right? So they were worried about They were worried about, for example, the rare side effects, the blood clotting. They hear about the blood clotting with Covishield, right? So they were worried about it. Now they've got the virus, and the virus has 10 to 100-fold higher chances of developing blood clots. So you picked up something which is like 10 times, 100 times more risky than, something which has a very, very, very low chance of having a side effect. I would say whichever vaccine you get first, go get it as early as possible.
So you have got the message right from the doctor himself that please go get the vaccine, whichever you get first. Don't wait for a specific kind of vaccine. So I would have liked if we could continue the discussion for a longer time, but I know it has already been a long discussion. So we come to the final question for today. It's somewhat similar to the self medication, doctor. So basically, yoga and breathing exercises. Now I see a lot of people recommending breathing exercises and yoga. So if you prescribe yoga or breathing exercise for a COVID patient, what kind of a patient should that person be? Like, what are the terms and conditions?
My personal opinion is that when you are actively infected with COVID, you take rest. It's like having a fracture in your leg and then thinking, okay, running is good for health. Let's go running. So let the feet recover. So let the lungs recover a little bit. Don't be completely sedentary. Don't just be always in the bed and just like, even if get up, sit for some time, walk for some time, but listen to your body, right? If your body is telling you that it's very tired, it's you're not able even to eat, right? Then at that point of time, thinking of doing an exercise is probably not a good idea, because your body is telling you that there is an infection inside. So your lungs are recovering from that. So body is demanding that rest. So give the body that rest. And once you recover a little bit, then slowly start picking up, your exercises, all these things like pranayams, and these are like exceptionally good for health of your lungs. But do it when your body allows you to do it, and don't force yourself when you are ill. So first recover, gain your strength, and then start doing the exercises.
I would really say that I am very grateful to you that you have accepted our invitation and you came for our talk for today. And for me personally, I have got a lot of insights. What about you, Raghu?
For me, it was really, that's true. Some of the things people should know. It is, there was a time when we were more worried about misinformation. Now we are worried about a lot of information, and a person cannot process it. So I think that this was a clear initiative that we can process that information and give people a better chance to understand. Even the last thing Ujjwal bhai said, I personally have seen that when you are doing exercise, my father, when we contacted COVID, he was doing exercises because it was told that do pranayam and all, it will work. But it just his condition got worse because of that. And by God grace, I got in a hospital bed and all that, so it was fine. But yeah, take rest. That is the best thing. Take rest and watch the video I told about Virus Dunia. That is a very good video. I also followed it. Thank you.
And
Thanks,
you
everyone.
would also like to share your social media handle, Doctor, please. I would like you to, so that people can contact you directly. So if you
Yeah.
could just mention.
Yeah, it's basically I'm on Twitter. You can contact me at Rathore. And you can also you can just follow my channel on Virus Dunia and just put your questions there. I'll be happy to answer them. Yeah, I'm sure we couldn't cover everything, but if you have more questions, just put in the comment box on the YouTube videos. Yeah.
Thank you so much for an insightful discussion. We at the overview are very grateful to you for accepting and coming here and giving us so much of information in such a short time. Thank you so much.
Thanks for having me. Thank
Thank
you.
you.